I'm Dr. Robin Farias-Eisner, the Academic Chair of the Department of Obstetrics and Gynecology at CHI Health. I also have a couple more roles. I am the Executive Medical Director of the Women's Health Line at CHI Health, and also the Director of GYN Oncology here in the organization. The diagnosis and the early diagnosis is key and critical to the effective management and treatment of the gynecological malignancies. For example, ovarian cancer, which typically is diagnosed in over 80 to even 90% of patients when advanced, because of the symptoms and signs that elude the clinician, can be now diagnosed, fortunately, through serum tests or blood tests, specifically one that my research laboratory at UCLA identified and developed. A group of 5 proteins that, taken together in the blood, they change in the event of early stage ovarian cancer. And when I refer to ovarian cancer, I'm also including fallopian tube, primary peritoneal cancer. These are all within the umbrella of quote-unquote ovarian cancer. The test is called OVA1+. It's a multivariate assay in the sense that we use ELISA or a variety of radioimmune assays to detect these proteins early, even before they can be seen on imaging in microscopic cells in the ovaries or in the fallopian tubes or in the peritoneum. The advantage is that it is far more effective than the standard CA-125 levels, which are present in elevated CA-125 levels are present in only 50% of patients with early stage ovarian cancer. So the diagnosis is quite difficult using CA-125. The Society for Gynecologic Oncologists put out a statement specifically about OVA1+ as a helpful serum test to aid the clinician in determining which patient should be referred to a gynecological oncologist. And the specific subset of patients are those with an ovarian mass, whether cystic or complex. In the event that there is an elevation in the OVA1+, then it's that group of patients with an elevation that should be referred because of the high association with either a borderline tumor, that is an ovarian neoplasm of low malignant potential, or a frankly invasive lesion of the ovary. So I would encourage my colleagues to consider serum OVA1+ testing in order to determine which of their patients in the presence of an ovarian cyst should be referred to the gynecological oncologist, because that is the patient with the greatest index of clinical suspicion for either a borderline tumor or a malignancy. Cervical cancer, fortunately, can be diagnosed through Hpv testing. So the precursor of cervical cancer can be diagnosed. And that's why it's so important to be compliant and the patient undergo pap smear and Hpv testing. Endometrial cancer, which is actually the most common cancer, GYN malignancy, and is rivaling now colon cancer, so it's becoming the 3rd most common cancer in women after breast and lung. Cervical cancer, because it can be diagnosed through pap smear, unfortunately endometrial cancer or uterine cancer cannot be diagnosed through pap smear. Under study now and under research in my laboratory here, and work I brought with me from UCLA, is to identify new markers for the diagnosis of endometrial cancer.